Hi, my name is Dr. Tim Colton. I'm a Boston oral surgeon. I have private practice down in Norwell, Mass. and teach at University of Boston Medical Center. What we're going to do tonight is a concise tutorial on the administration of the Kovanaze mist and the most important aspects that are necessary for its success. This is a very technique-sensitive drug. It usually takes about 7 to 8 uses, practice sessions, to become proficient with this. What we'll discuss are the 3 specific parameters that need to be accurately met. And the first 2 of these parameters are absolute. You've got to hit these right on the head. First one is the anatomical position of the syringe in the mist. Second is the mechanical atomization of the liquid into the mist form. Third is patient education and mental preparation. So first, why don't we just discuss patient preparation, inform the patient of the technique and the possible sequelae. Discuss the side effects. One of the failures we heard of was a lady that was numb, but got some of this in her throat and wigged out because she had a little difficulty swallowing. So discuss the side effects. If they do get it down their throat, and it's about a 20% chance that that will happen, have them take a drink of water slowly. Don't let them eat or drink hot fluids. And if they claim they're having trouble breathing, just mention to them, hey, you're talking, you're breathing. Now, what the demonstration does, it removes that fear of the unknown. And what he actually does is shows them the mist and the syringe so they know what is going to assault them. So it removes the fear of the unknown and takes away that visceral response to recoil when your nose has got something violently shot up it. Now, he also uses the count of 3 to prepare the patient. 1, 2, 3, inject. After you do that injection, have them sniff a couple of times. Now, the second thing we'd like to address is the extreme importance of positioning the syringe in a proper anatomical direction. And remember, there are 3 planes to the skull. Let me use this little board here. You've got the sagittal plane, horizontal, axial or transverse plane, and then the coronal plane. You need to be parallel the sagittal and parallel the horizontal plane to give the first injection, and then parallel the sagittal and 45 degrees to the horizontal to give the second injection. In these sagittal and coronal diagrams, you can confirm visually the anatomic landmark targets of the middle and inferior meatai. Now we'll be looking at the actual clinical situation with Maria. We'll use a face bow to demonstrate the horizontal plane. Parallel the horizontal plane, or the axial transverse plane, means parallel the floor of the nose, which is simply parallel to the hard palate, or externally parallel the ala-tragal line, which is the same plane as used to set up a denture occlusion. The important horizontal parallels to reference in aiming your syringe are the ala-tragal line, the floor of the nose, the palate, the occlusal plane, and the floor of the room. Your syringe should be in reference to those parallels. The first spray must be parallel both the sagittal and horizontal planes and perpendicular to the coronal plane. In actuality, a 20-degree angle above the horizontal plane aims the spray more properly down, which is more accurately aimed towards the inferior meatus. Dr. Goldberg will demonstrate the proper angles of injection using our patient Maria. The first spray must be parallel both the sagittal and horizontal planes and perpendicular to the coronal plane. In actuality, a 20-degree angle above the horizontal plane aims the spray more properly down, which is more accurately aimed towards the inferior meatus. For spray number 2, it must be 45 degrees to horizontal and the coronal plane, but maintaining parallel to the sagittal plane. We're aiming for the middle meatus, where the lateral wall of the nose contains a sphenopalatine ganglion at the posterior portion of the nasal pharynx. The ganglion sits above the trigeminal nerve only 1 millimeter away, and hence the occasional numbness to the lower jaw. The tip of the syringe advances the same distance as the first injection, but does not require lifting of the nostril. Aim towards the middle of the nasal cavity, not the middle of the nose, which is the septum. It must be 45 degrees to horizontal and the coronal plane, but maintaining parallel to the sagittal plane. Now we can look at a coronal section of the head, and you can see where the inferior meatus is below the turbinate, the inferior turbinate or concha number 22, where the yellow dot is. That's the inferior meatus. Then for the second injection, you're aiming higher to just below the middle turbinate or middle concha, and that's number 21, to the middle meatus. Parallel the sagittal plane means parallel the nasal septum and aiming directly into the middle of the nasal cavity. Once that is done, you should move the tip of the syringe around to make sure it is aimed into the middle of the nasal cavity. If aimed towards the middle of the nose, the mist will simply hit the septum and condense into a liquid which will not reach the inferior meatus. If aimed laterally, similarly, the mist will condense on the lateral wall of the nose, too far anterior to the inferior meatus. Third thing I'd like to discuss is the mechanics of the plunge, with Dr. Schapani showing you how to do this. A two-hand hold is probably the best bet, and stabilize your hand on the chin of the patient. Patient will be sitting upright, pupil to pupil, doctor to patient. This gives easier manipulation of the syringe. It's actually important to stand on the ipsilateral side of the patient or the side that the procedure is being done on. There's an increased failure rate of 20% if this is not done. Use the two thumbs to press on the plunger. This allows a straighter plunge and less likelihood of bending the plunger. Stabilize one of the hands against the face. Make sure the plunger moves and not the barrel. There must be a fast plunge of the plunger. This is not the administration of needle injection into tissues, which we've all learned should be done slowly for comfort's sake. The fast expression of the solution produces a requisite 10 to 50 micron size droplet. Any size different than that will be absorbed by respiratory mucosa. A hissing sound means the fluid has atomized and entered the nasal cavity, which is a void, and has not hit tissues where it would simply condense into a useless liquid, not traveling back into the meatus.
My name is Dr. Stuart A. Liss. I practice in Hanover, Massachusetts. General dentist. Over the last 5 years, I've been anxiously awaiting the Kovanaze to come out. Fortunately, we got it 2 weeks ago, and I've been able to use it on 12 patients so far. And all 12 patients have been 100% anesthetized just with the Kovanaze. Didn't have to stop any procedure, didn't have to rely on a syringe for anything. I've done 1 root canal, I've cut 6 crowns, and I've restored 7 teeth. The palate gets extremely numb, which makes restorative dentistry and crown and bridge dentistry quite easy. Okay, so we're going to place the Kovanaze in a horizontal plane to the base of the nose, like this. I hold the patient's head steady, and we're going to go like that. Good. Okay, so it's been about 4 minutes since we administered the first dose. We're going to do the second dose. The patient already reports that her front teeth, basically teeth numbers 9, 10, and 11, are pretty numb already. But seeing that we're going to be working on the bicuspid, we're going to go ahead and do the second administration. Again, she's going to turn her head towards me. I put my left hand over here. This time we're coming in at 45-degree angle. You want to make sure that the barrel or the head of the syringe is really not touching anything. It's just there. And we're going to administer it. So I'm going to do this again. And you heard that nice loud mist, that sound of the spray. That way you know that you've atomized the particles. You have that beautiful plume of the tetracaine doing what it's supposed to be doing. You can sniff a couple times, and she'll be well anesthetized. In another 3 to 4 minutes, she'll be ready to have a restoration done.
Hi, my name is Dr. David Pellegrini. I practice in Duxbury, Massachusetts, and I'm very excited that Kovanaze has finally come to market. At least a half dozen of my patients have told me they wanted to delay their treatment until Kovanaze was available because they had a fear of dentistry, and in particular, the injection that is involved with administering local anesthetic. And she felt numbness on the facial side of the gingival tissue from tooth number 7, the lateral incisor, over to tooth number 13. And she felt numbness on the palatal side from the midline to about the first molar. So we're going to go ahead and proceed with our restoration. It's tooth number 12. It's an occlusal. Now we'll excavate the caries using a slow speed. Anything hurt, Siobhan?
Kovanaze was very painless. It numbed my mouth very quickly. No pain. I could still move all of my mouth and feel like in control. Once he did the work, I could not feel a thing. I think the Kovanaze would be great for kids. My son does not like needles. If he knows he's going to have a cavity filled, it would make him very nervous. I look forward to having Kovanaze when I come to the dentist from now on, so I won't have any needle stick pain or residual pain later. Kovanaze over a needle any day.
One girl who was 23 years old was extremely apprehensive about having a filling done. She had canceled 2 previous visits because she was apprehensive about the whole procedure. She happened to be in for hygiene the day that I received my shipment, and I said, we're going to fix your tooth today, and I'm going to do it without having to use any type of needle. And she said, that's awesome. And she was 100% numb, couldn't feel a thing. Most patients have been numb anywhere between 45 minutes and an hour and 10, hour and 15 minutes. One gentleman that I did 4 crowns, teeth numbers 6, 7, 8, and 9, he was numb for about an hour and a half. And we did 2 doses on both sides. But we got the procedure done. He was ecstatic that we didn't have to use a syringe. And I'm not sure that case would have happened if it was up to me using a syringe on this gentleman. He had been talking about the case for possibly about 10 years. And I actually ran into him at breakfast the day that I received, the morning after that I received my shipment of Kovanaze. And I said, you want to come in Thursday morning? I can do it without needles. And he said, absolutely. Didn't even ask what the price is or anything like that. I told him there was no extra charge for the Kovanaze, and the case went well.
What I've found is that the patients are having a very pleasant experience. They know that they're not getting a shot, and they're very accepting of having the mist sprayed in the nasal passages. And the anesthetic itself has been very effective, as demonstrated by the procedure that was done on the videotape that you're now watching. I'm happy Kovanaze is available.
I loved the Kovanaze that you put and sprayed in my nose. It numbed all my front teeth in the side, and it was way better than getting a needle up in the roof of my mouth. My lips are not numb, and neither are any of my facial muscles at all. It's just like completely different than getting a needle. I would pay not to have a needle in the roof of my mouth. Believe me, I would. There's nothing more painful. I'd pay $100 not to have a needle in the roof of my mouth.